Alright guys, this is Jerningham here. Could there be 55,000 deaths in the UK soon? Or could there be 100,000 deaths in 10 weeks in the UK of coronavirus? Then they're saying extra deaths as MPs accused government of failing the BBC. So we're going to play the video and see what you guys and girls think about this. And people that like the news.
Well, 2.5 months have passed since the first registered death from coronavirus in the UK. And in a usual 10-week period, there would be, on average, around 100,000 deaths in the UK. But the latest figures from the Office for National Statistics suggest that there have been an additional 55,000 deaths in the UK during that period, all of them directly or indirectly related to the pandemic. It's known that just over 41,000 deaths were directly related to the virus, as recorded on death certificates. The latest figures also show more than 11,500 people in care homes have died with coronavirus since the beginning of March. Our correspondent Alex Forsyth reports now from a care home in Rugby.
The scale of this pandemic is becoming increasingly clear. The number of deaths still growing, although the rate at least now slowing. Behind every figure, a face, every statistic, a human story. Of those who've died so far, more than a quarter were in care homes. This family-run home in Warwickshire had an outbreak last month. One resident did die, but staff were able to control the spread of the virus, although managers say they had little government guidance or support.
At that point, the measures weren't in place to protect the residents and the staff. The testing wasn't there, and we're very lucky from management and staff that it wasn't a lot worse.
What about now? Have things improved?
I haven't seen much of a difference at the moment. We've really made our own decisions, and we still really haven't had much more from the government.
Here they're still waiting for all staff and residents to be tested, still saying the system's too slow. Concerns reflected by care leaders this morning. In a meeting with MPs, they were critical of PPE supply, testing facilities, the national strategy.
Our focus at the start of this pandemic was clearly the NHS, and there was not a recognition in either the planning process that happened in 2016 or indeed in this current pandemic at the very start of it, that the most vulnerable people were in care homes.
So some of our problems around transmission, no doubt, are relating to PPE, and very sadly, some of the deaths too.
This has been a health pandemic, and what we haven't felt in the care sector is that we've had a health response.
Secretary of State.
The Health Secretary again today defended the government's approach. Despite the claims to the contrary, he said again they'd put a protective ring around care homes.
From the start, we worked hard to protect those in social care. In early March, we put £3.2 billion into social care, half through the NHS and half through local authorities. And we've repeatedly set out and strengthened guidance for infection control and support.
Across the country, the care system is complex, made up of local, national, public and private elements. The government has put more money and measures in place in recent weeks, but the criticism is still the support isn't always getting where it's needed quickly. And now some care providers say they're under financial pressure.
This care home in North Yorkshire is one of 4 in a group where extra costs from coronavirus and empty beds is making money tight, according to the owner, who also speaks for the sector.
We've calculated that we're going to be around £100,000 short in income, and that is the difference between us surviving as business and not surviving. The issue is we've got the NHS run nationally, local authorities running locally. That's why we've got a problem with PPE testing and finances. It's all a mess, basically. We need to make sure we plan and have it centrally, in my view, centrally organised.
This crisis has exposed issues in a sector that's long been under strain. The calls now are not just for continued short-term support, but a longer-term solution too. Alex Forsyth, BBC News.
Let's turn then to the issue of testing, and the number of COVID-19 tests carried out since the beginning of the outbreak has been inadequate, according to a parliamentary committee at Westminster. The Commons Science and Technology Committee has criticised the government for failing to deliver a much more efficient testing system much sooner. But ministers have defended their strategy, saying it was right during the early period to prioritise those in hospital over community cases, as our health correspondent Sophie Hutchinson tells us.
A new mobile testing centre in Cornwall to help deliver the government's promise to test everyone over the age of 5 with symptoms of COVID-19. But MPs on the Science and Technology Committee say testing capacity has not been increased early or boldly enough. Back in March, this was the message from the World Health Organization.
We have a simple message for all countries: test, test, test.
But 3 days before, the UK announced it had stopped testing all suspected cases in the community.
We will pivot all of the testing capacity to identifying people in hospitals who have got symptoms so we can pick them up early.
In a letter to the Prime Minister, MPs said they believed a lack of testing capacity had driven the government's strategy. They criticised Public Health England for failing to provide the scientific evidence used when deciding not to bring in mass testing. They said the cost of the ongoing lockdown was vastly greater than the cost of rolling out large-scale testing, and that by not regularly testing hospital staff and care workers, vulnerable people had been put at risk. Many care homes say that they're still struggling to get all the tests they need to ensure that staff aren't infectious.
The problems with the lack of testing is obvious, as the national picture shows. It's not safe, and how they can say that they're going to start rolling it out to 5-year-olds and everybody in the country, I just don't think they've got the capacity there. And I think they'd probably rather a bit of honesty from the government, really.
And one prominent public health expert said the UK's testing strategy had been badly handled.
They have an incoherent and a chaotic strategy towards both testing, apps, and also the contact tracing. It's all centralised and top down.
At today's briefing, the Environment Secretary defended the government's testing strategy.
Your strategy has been based on capacity rather than the science.
We were building it very rapidly from a very early stage, and we have now got to the point, as Matt Hancock pointed out this week, that we can offer tests to anybody over the age of 5 with symptoms, and that's going to be pretty critical in terms of developing that track and trace capability.
Ministers say they've recruited more than 20,000 contact tracers to identify infections and hotspots of the virus, but one has told the BBC the tracker app wasn't working yet and won't go live until Thursday. There are clearly ongoing challenges to the government's testing strategy. Sophie Hutchinson, BBC News.
Let's go live to Westminster tonight and our chief political correspondent, Vicky Young. Vicky, yet more severe criticism of the government, not just on testing, but on care homes as well. What's the response been?
Yeah, I mean, they are facing real scrutiny over all of this, and it is, of course, partly about blame. There's a real sense of tension today between ministers saying, look, we listen to the scientists, and the scientists saying, well, on things like testing, there is no point in recommending a mass testing programme if the system isn't in place to deal with it. But it's not just about blame, it is about learning from mistakes, and we heard that loud and clear today from the care sector. You could just hear their frustration and their anger, really. They've thought for some time that there's been too much focus on hospitals, on the NHS, and that care homes really are just a bit of an afterthought. They think the two need to be far more integrated. Now, of course, that is nothing new. We have heard ministers talk about that for years, but it simply has never happened. Now, I think this epidemic has exposed serious flaws in the system, and I think now that long-term aspiration really to integrate health and social care, well, that's really becoming a very urgent priority.
Vicky, many thanks again. Vicky Young there for us at Westminster.
Well, I hope you've all enjoyed that video, guys. Give it a like, give it a comment, and girls as well. Not everybody watches the news or has time to watch the news, but anyway, I better go now. Thank you for joining me. See you in the next one. Peace.